thank you for being here to hear our Edson story and what we have to support the work that you do. So I say nurses make it happen, but as you heard today, we all work together to make things happen. But I want to focus on nursing for a number of reasons. But first of all, proudly, I want to announce, if you don't already know, that once again, for the 22nd consecutive year in a row, nurses are ranked #1 in the Gallup poll for being the most honest and ethical profession. So thank you, nurses. I am a proud nurse and a proud nurse practitioner for a long time, and I think somebody said I was doing something before any of you were born. I'm pretty sure I was. So just by the numbers. Now, you've heard a lot about nurses pandemic, during, and post for all kinds of reasons. But you know what? Everything that you're hearing about, if you're not a nurse, it's not new. It's just that it came to the surface and everyone could see it. But here are the numbers. 5.2 million RNs in the United States. In Arizona, we have 113,000. We also have registered nurses, advanced practice nurses. We also have LPNs. I'm not going to go into the numbers of licensed practical nurses, but our community college colleagues educate them, and they are really important in the workforce as well. But if you can look here, there's 4 advanced practice nurse roles, and you can look at those. The most numerous in Arizona are nurse practitioners, but we also have clinical nurse specialists, certified nurse midwives, and CRNA, or certified nurse anesthetist. And by the way, nursing is a profession. The stereotype of a nurse is that we wait for somebody to tell us what to do, meaning a physician gives us an order, and then we carry it out. That's true in some settings, but by the way, nursing is a profession. We have our own theoretical foundation. We have our own specialized skills. We have self-regulation, meaning we regulate ourselves legally, ethically, and professionally through the boards of nursing. We are autonomous, especially advanced practice nurses, but every registered nurse has an independent scope of practice that we can do things without anyone giving us permission to do so. It's well within our scope of practice. And for registered nurses, the scope of practice is pretty standardized across the United States. For advanced practice nurses, not so much. There's 26 states that have autonomous practice, meaning no supervision is required by a physician or other level of provider. But there's still about half the states that need some level of supervision. We have our own code of ethics, which is a hallmark of a profession. My colleagues here that are social workers, that are psychologists, that are sociologists, you also have a code of ethics. Nursing has a code of ethics as well. And you know what's fascinating? They pretty much all say the same thing. So I'm not sure why we don't have a healthcare code of ethics. As I said, we have a scope of practice. We also have standards of practice. So when there is a complaint, if you will, or a perceived wrongdoing, nurses are compared with what would another nurse at the same level of practice as you, what would be prudent practice in that nurse. So we do have standards of practice that we all must abide by. And we have a social contract with society, meaning we're altruistic, but that does not mean that we should be taken advantage of or disrespected in any way. But we have a social contract to provide a level of care to our communities. And why do I say nurses make it happen? Because you can read this for yourself. Nurses are everywhere. And as I listened today to my highly valued colleagues, all the research that's happening, nurses are in those settings that can participate in research. We have nurse scientists doing independent research. You heard from 2 of our researchers today that are nurses. But we translate the research that's happening into the populations that we serve and that we have access to. And nurses are everywhere. This is like a list with pretty much everything I could actually think of and that I know of. But, you know, oh, guess what? There's a nurse walking out there. You might not know it's a nurse. How many of you been on an airplane when somebody said, is there a healthcare provider or a nurse here? How many of you been in a restaurant that somebody said, someone's choking? Is there a doctor here? And then no hands go up. I'm a nurse, and there are some people in this room that were with me when that actually happened one time. So we're everywhere. And the last thing I put is that we deliver telehealth competently, compassionately, and effectively, as well as being places in person. So what is our impact? It's broad, it's diverse, but we, in practice, we really are health promotion experts. We provide health education. We also care for the ill and injured, and we care for the dying through the process through hospice and palliative care, and hospice with comfort measures, compassion. We implement science, evidence-based practices across all populations. And we make innovation real. So you can see here, this is a model of what nursing can provide in the innovation space. So we have a nurse scientist, you can see at the top, nurse innovators, entrepreneurs, intrapreneurs. So Dr. Laser mentioned his work. He was actually an entrepreneur, in a sense, within his organization when they decreased sternal wound infections. It's costly, it impairs quality of life. So when things happen in your own organizations or in the community, that is innovation, evidence being applied in a new setting, research being translated in a new population. Does it work? Hopefully so, yes. If it's not good outcomes, then we're not going to do that again. So there's also business entrepreneurs, and one of our PhD students right now, who has been a nurse colleague of many of us, including me for many years, realized a problem: home health care. The access was not available to everyone, so Jasmine Body started Navi Nurses, and she provides home care through nurses where the patients and families are. There's also social entrepreneurs, and so you can see that we use the skills that we have and apply them in many different settings. We also look at the ethical application of innovation. So we don't do things to do them. We maybe have a lucrative outcome, which would be great, but always done with ethical application, in technology in particular. So practice, education, and research. Artificial intelligence is a part of all of our lives right now. So my Fitbit, there's not a person in my Fitbit that tells me it's time for me to walk. I mean, or your car, you know, hello, Katherine, good morning. There's not somebody, you know, in my little, you know, dashboard. So we use it all the time, but we don't think about that as intentional as we do of applying and utilizing artificial intelligence to help us deliver better care and outcomes. We, in the academic center setting, we are looking at the research related to artificial intelligence, virtual reality, augmented reality. We have a research colleague who is bringing this to our students so that they will be very proficient providers, knowing how to apply ethical use of technology, when to apply it, and how to measure outcomes. And I just have a list here. So Nurse Innovators did not just happen in the last few years. 1858, Florence Nightingale, she came up with environmental theory. She realized that people were dying because of unclean environment. So if you look from like 1858 to now, you can see some of the things that have happened. Feeding tubes. A nurse realized that patients needed to be fed in a different way. How could we give them nutrition? So feeding tubes, ostomy bags, a crash cart. So instead of nurses putting all of the emergency medications and supplies in their pockets, they realized, how about we put a cart together and we can run with that? So you can kind of see some of the more recent advances. Prone positioning, those of you that are nurses know that prone positioning is well known for intubated and unconscious patients. But guess what? Nurses figured out we should be proning patients with severe cases of COVID-19, whether they're intubated or not, and awake or not. And those outcomes of patients were better because the nurse took the chance to apply a well-validated intervention to a different population. So nurses are being recognized financially through grants and through awards. So I just have a few of those that you certainly can go on to look at these, but you know, there needs to be money. So we were talking, I think it was the invisible caregiver today. Nurses' work has been invisible for such a long time. Things just work. Hospitals run. Patients get better. But it's because that's what we do, but we don't call attention to ourselves. And now others are recognizing we should not be invisible. We should not be giving away things for free. We really should be rewarded, recognized, and supported financially to make our interventions become available across populations. So thank you. I appreciate it. I am happy to be part of the Edson College interprofessional team, and anything we can provide to you and your setting, we would love to. So these are just some photos of nurses that have made a difference. And one in particular I'm going to call out. In the bottom would be your left, Loretta Ford, in the kind of peach-colored jacket. She is the very first nurse practitioner ever in 1965. She's still alive. She's 102 years old. And we just had a virtual birthday party for her. She was born on Christmas. So anyway, thank you.